Hello. Good afternoon, everybody, and welcome to our clinic affairs. Still loading. I hope I'm live on Facebook. Yes, I don't intend to keep you long. Get your friends, come, let's discuss some conditions that affect our children's skin and what we can do quickly when we recognize it and save our money and also save our feet from going to hospital, and also beat the queue in seeing your GP. Go get your friends, come, let's listen to Clinic Matters. And I hope you're seeing me on Facebook. If you're seeing me, please can you acknowledge that I am live? You can see me. Okay, thank you very much. All right, so we're back again this week on Clinic Affairs. So today we're going to be discussing on the pediatrics dermatitis. So dermatitis is inflammations of the skin, and most of the times we see that our children are having one problem or the other, and sometimes we get panicked because we don't really know what it is when we wake up in the morning and trying to change your baby and you see some rashes on their skin. So you can always come back to this recording to see what you can do. All right, so let's start now. So it's me, Dr. Precy Simon, your host in Clinic Matters today. So we are going to be looking at the first case here. As you can see, this redness you have seen in this baby's hand, you can see it's something that is very common. You can see this in babies quite a lot, and these areas here we call them flexors because these are the areas that we flex. Even adults, but children, we keep flexing, and sometimes we notice this as well. Sometimes we also see it on the faces of our children. So, and then we get worried. Okay, what's happening to a child? I hope this internet is not playing up today. So what's happening to the child? What can we do? So you begin to worry, when you see things like this happening to your child, and then you rush to the hospital and then you get some treatment. So I just want to say that when you wake up and see this thing happens, sometimes it just starts very little, and as time goes on, with days, it starts advancing, and it's going to be very itchy, and your child will be itching and itching and itching on that area. Sometimes it could be so serious that you see your child is itching till blood is coming out of that area. So this is called eczema, and a lot of us, we've heard about eczema, and sometimes we don't really take it serious. We just think, oh, eczema is not serious. But yeah, for adults, it might not be a serious condition, but for children, it is very serious condition because it is going to disrupt so many things in their lifespan, and for them to keep itching and they're not happy because they can't even speak of how they are feeling. But as a parent, when you see this is called eczema. So eczema is a condition that is hereditary. I just want to mention that it's something that is inherited, so it's a genetic condition. Eczema is not allergic condition, because a lot of people, when they see a child having eczema, they are so scared that maybe they've done something, maybe they didn't wash something properly, or maybe the child is allergic to, maybe when they went out, maybe they have a dog or a cat, they begin to think that the child is having an allergy. So I wanted to know that eczema is not an allergic condition, is a hereditary condition. And you find out that so many times when a child comes to the clinic and we start to take history, by the time we look at the history of the parent, we'll find out that the father or the mother have got issues with psoriasis, dermatitis, and eczema. It runs in the family. Sometimes both of them don't have it, but the grandmother have it. So get to know that. So, but now, how do we treat this? So the first thing is that eczema is just dry, and if the area is very dry and itchy, and it starts from this itchy before it becomes very reddish, like you can see now. So the first thing you should do is to wash your baby, keep that area clean, and then you need to get what we call emollient or moisturizer. And it's not all emollient and it's not all moisturizer can be used. So when you pick it up early, so you can just go to the pharmacy and you can buy one of the moisturizer that I know, an emollient that works so much um for eczema on babies. We call it Diprobase. So Diprobase is very good, and there are a lot of other ones like Epidem. Epidem is also very good, but Diprobase is very good. The reason Diprobase is good is that it's going to help to moisturize that area and take away the dryness. And let me just tell you that sometimes this eczema also occur on the face, not only on this flexus, right? So Diprobase is very good in that it can help when you apply it. You apply it enough on this area, so it will take away the itchiness and also take away the redness, like you have seen here on this one, right? This screen here, this is the time to catch it very, very early. And eczema starts from children from the age of 0 to 5. They come in with this quite a lot in the hospital. You see them a lot in the clinic, especially in GP surgery. You see children with this. So this is very early. So if you're able to go to the pharmacy at this point to get the emollient, the Diprobase or Epidem, like I said, Diprobase is my number one that I'm recommending. And that's also what NICE guidelines are also recommended. You buy it and then you apply it here after you have your shower, give your baby a shower, apply it here once in the morning and then once in the evening, and you monitor it. If after application of this Diprobase for about 5 days, and the baby is still constantly itching, and then it progresses to this. So when it gets to this point now, it means that it's becoming very serious. And that is when now you need to come to the clinic, because we need to prescribe hydrocortisone cream. So we call it topical steroid. So the hydrocortisone 1%, we need to prescribe it, and then you apply on your child, and then it will finish. And I just want to say that we don't do any blood tests for eczema, because eczema is not infectious disease, and you cannot stop your child from going to school, because it's not going to get, nobody's going to get infected by the child going to school. And also, children between 0 to 5 are prone to this eczema, and also up to the age of 9, 10 years old, they are also prone to this eczema. And but one thing I have to assure a parent here is that the more your child grows, they will grow over this eczema. When they grow over the eczema. So by the time they are age 12, 13, 14, they may not end up having this eczema again. I hope you understand what I've just said. So I'm going to move to the next condition now. So the next one I'm going to be looking today is that we call it a nappy rash. All right, so you can see most of this condition happens a lot in young babies, and you can see your child when you're going to change the baby, you see this rash is coming out. Sometimes they start very mild and later they become very acute. Like you can see this one actually this area is completely bleeding. Sometimes when you take off their pampers, you may end up seeing this, that they are having some blood stain on their pampers. This is called nappy rash. So, and sometimes, okay, in darker skin children as well, you can see these areas that are so sore and swollen. The reason is that because this area, as you can see, that's the baby's bum, and because we always like to cover it with pampers all the time, and this part of the body, we don't have enough air that goes in there. So this forms a very, very good place for bacteria to flourish. So when the baby also wee as well, and if the baby wees and it take a long time for you to change the nappy, so this will happen as well, because the uric acid within the urine as well can also cause fermentation, can also cause inflammation of this baby's bum, and also it will also lead to this nappy rash. So that's why we always encourage moms, and especially moms, and if you're a dad and you have responsibility for your child, we always encourage that you change the nappy frequently. You change it very, very frequent, because that will help to kind of keep your baby clean, and also reduce the amount of uric acid that is burning your baby's private area. So now, the next thing that I will also say about nappy rash here is that sometimes it's because of irritants as well. Irritants like from the soap that we use in washing the baby's nappies and towels and clothing, and all the things that we use for babies. Some of the detergents are very, very strong, and when you use it to wash baby clothes and all the things they use, it can end up having this causing this nappy rash. So, and we always recommend non-bow detergent for mom to use. And when you wash the clothes, if you're washing in washing machine, you have to rinse it properly. So when you rinse it the first time, you still need to rinse it again, and then that will help to remove any residual detergent that are in those clothings, because any residual detergent now will also cause a flare up. It can flare up the skin as well. And like I mentioned in the eczema as well, you have to keep the area clean when I was talking about eczema, and keep their clothing clean as well. So how do we treat nappy rash? We also treat the nappy rash like the same way that we treat almost a similar way we treated eczema. But the only different thing is that because of the growth of some of the fungi here causing a problem. So we will start by giving and prescribing what we call antifungal medication, and it's going to be like topical. Topical means that you apply it. Antifungal medication, that is like what we call cotrimazole or fluconazole, and even metronidazole cream. And people that are watching me from Nigeria, we talk about metronidazole. You people call it flagyl. I remember you people call it flagyl. So you can get this flagyl cream from the pharmacy and you apply it. People from the Caribbean, what you are fortunate, these are being sold, and even in England and America, is sold in the pharmacy. So when you see your baby having nappy rash, at the early stage, the first thing you do, just go to the pharmacy and buy cotrimazole cream, okay, or fluconazole cream. So when you have that cream, then you will put the cream on the bum and smooth it very well. And you can do that before you, when you change the nappy, clean the area properly, apply it, and then put the nappy. So it will form a barrier. So it form a barrier and prevent further fermentation by fungal or fungi. Okay. And now, if it has progresses to this level, you can see this is very large and very angry. and you can see it's bleeding so much, then this is the time that you need to see your doctor, because it's not responding to the fluconazole, for the topical fluconazole. So at this time, you need to bring your baby to the clinic, and this is when the doctor is going to be prescribing you. We prescribe what we call 1% hydrocortisone, because the baby as well, at this point, the baby is itching as well. And it's worse because the baby cannot get to that point to itch, because you put them on the diapers. So even if they feel like itching and they cannot itch themselves, they can't scratch this area because it's been protected. So the baby will cry and cry a lot, and they will cry and cry a lot. So when you see the baby is crying and you keep seeing that the cotrimazole is not working, then you need to go to hospital, and then you're going to be have 1% hydrocortisone prescribed, and you apply that and it will work. So I just want to say that sometimes when you apply this hydrocortisone cream 1%, you still have to continue to use the cotrimazole. So you're going to do what we call stepwise approach. So the first thing is you apply the hydrocortisone to areas that are very reddish and very angry, and the areas that are not very red, you apply the cotrimazole cream. And if everywhere is so reddish, so you apply this cotrimazole cream first to moisturize that area, and then you put the hydrocortisone cream on top of it. So it will help. But I just want to say, from the first condition that I've explained, the eczema, and getting to this nappy rash, you get to sometimes that you find out that this reddish bright wound here start discharging. So when they start to discharge at that time, when they start discharging at that time, it means that it's getting infected. So some yellowish discharge start coming out of when you're dressing your baby. It's no more it's no more reddish, it's no more bright red. Now it become yellowish. It could happen also in the eczema as well. This area you're seeing here is just angry and red, but after some times, if it's not responding to treatment, you start to see them, bringing oozing and pores and things, start to look infectious. And also you have to check your baby's temperature. If you check your baby's temperature and the baby start to spike temperature, that shows you that the infection is coming in, the baby is getting infected. So now it has started from a fungal infection. Now it has become bacterial infection, because when you see those pores coming out, it means that staphylococcus has taken over, and then it causes the granulation of the body cells, and then you start to cause that infection and bringing the pus out. So you have to take your baby to emergency. Do not wait to say, I'm going to book the appointment to see my GP. At this point, you have to go and to A&E as soon as possible, so your baby will be treated, because baby get into sepsis very easily. And majority of children that are dying in this country, they die because of sepsis, and they arrive very late at the hospital. So you have to continue to apply those creams I told you for 7 days. And after 7 days and things doesn't change, then you need to take the baby to hospital. Okay. So the next one now I am going to be talking about here is hand, foot, and mouth. Hand, foot, and mouth. It is one disease that I in my practice I've not been fortunate to see this in person, but a lot of disease that has happened, and a lot of time for parents, and we call it fifth disease, because according to the classification by WHO, we call it fifth disease. So it comes as you see mild rashes like this coming in the mouth. After from the mouth, it gets to the hand and then to the legs. Sometimes it can start from the legs as well, and then goes to the mouth and the foot, and also It can also happen on the trunk. And this rashes now is spreading across so rapidly. You find out that sometimes we mistake it to be like measles, but you find out that it's always like the rashes is always like on the mouth and more on the cheeks and also on the legs. So for this case, you can see a lot of times that parents will bring the baby to hospital because they see the rashes on the face, on the mouth, on the hand. As you can see, it looks really scary, you know, and they want you to prescribe. They will say, doctor, prescribe antibiotics. In this case, we do not prescribe antibiotics. We don't prescribe anything because we just manage the symptoms, okay? So when this happens, you only have to monitor your baby's temperature. That's what I have to say. Monitor your baby's temperature all the time and ensure that your baby's temperature is not high, because this is going to go away. So after like 7 days, then it will go away. But the thing is that you have to keep your child away from school because it can also be infectious. But after the rashes appears, so for a period of 5 to 7 days, right, then it's no more infectious. So the first 3 days that the rashes comes out, you need to keep your child away from school because the child will be infecting other people. So you have to keep monitoring the symptoms. You have to keep monitoring it. And also, if you're a pregnant woman and you see a child, you have to stay away from them because it can also cause a lot of complication for pregnant women. So if you're a pregnant woman and you're a teacher and you see a student or your little pupil coming in to school with this, you have to stay away from them because it causes a lot of problems in pregnancy. And then there's no treatment, like I have said. It's just self-limiting, and after some time it will just go away. And the next the last one I am going to talk about now is impetigo. So let me find my impetigo. This is it here. So we also see this one quite a lot in the hospital. We call it impetigo. And you see the way at the beginning, you see the way it looks here. It just come out little pinkish like this. And once it comes up like this, we begin to wonder what's going on. But as time goes on, few days later, you can see that it will start looking like crusty thing, like you can see at the edge of the mouth, like stomatitis, angular stomatitis, inflammation of the angle of the mouth. And this is getting serious. And after some times now, it will come now to becoming infectious. So you see a lot of children and you see them having this. It means that there's an infection going on here. So we call it golden crusty rash. And sometimes it can occur even on the upper face, and it also can occur all around the lip. It can occur on one side, but majority of the time we always see it around here. So when you see this coming to your child, or you start to see this little crusty starting to come, this can be a very serious issue. You need to see the doctor as soon as possible. The first thing, if you get to the doctors at this time, you're going to be prescribed fusidic acid. It's called fusidic acid. So because it's a bacterial infection, so you have to apply the fusidic acid at this point, then it will help to clear these rashes away from your baby. But after you've applied the fusidic acid, you also have to monitor your baby's temperature. Once your baby starts to spike temperature and you give paracetamol and then the temperature comes back again and is increasing, that means that something sinister is going on. And with time, you start to see that it's spread. Once it gets to this point, you need to rush to the hospital. You have to take the baby to hospital because a lot of children are dying, especially it's very good like in developed country, like we can see like here, yeah, abroad, Europe, UK, America, they take the health of children very seriously. And don't get me wrong, in Africa, they take the health of their children even more seriously. But the problem we have is that they don't have access to health and healthcare facilities so quick. And sometimes by the time they see this thing happening, they just take it for granted. Oh yes, a lot of Africans, we take these things for granted that the baby is bringing out these things, and you start to say, okay, I'm going to apply this, I'm going to apply this. Self-medication kills a lot. A lot of children have died in Africa because of self-medication, because mother is just like saying, okay, I am going to apply this, something that was sold in the market, something that was advertised in the market, they keep using it. As the more you delay, the more things getting so bad. And I'm saying to you again, majority of children that are dying in the UK in hospital is because they are dying from sepsis, because the parent delayed taking action promptly, and then the babies will end up dying. Once you see things like this, you need to speak to the doctor. If it's happening just like this, you need, at this point, take your baby to the hospital, and you're going to be prescribed fusidic acid. Then you apply the fusidic acid and it will go, because impetigo is a bacterial infection. It's not a fungal infection like the first two I showed you, the fungal infection. So now apply it and monitor the baby's temperature. And every mother out there, I want to tell you, as long as your child is under 18, even when they are 18, you still need to keep an eye on your child. When they say they're not feeling well, don't take it for granted. Monitor their temperature. Once they start spiking temperature, please rush to the hospital and get this sorted. Especially if you give them paracetamol one time and it's not working, don't do self-medication. Take the baby to hospital. So when we get to the hospital at this point, then we need to give Fluclox. That is means that Fluclox is an antibiotics. So we need to give it when things happen on the skin. We prescribe Fluclox a lot, and then we can give the child Fluclox suspension, or also if the baby is baby that is like 6-7 years old and they are able to swallow it, they can have it. Otherwise, the child can be admitted and treated with antibiotics, and then everything will clear. So I think that's all I have for today, and I hope by next week, by God's grace, you stay with me. I don't like doing long videos. I just want something short that people can watch to the end. And next week, I'll be here to share another video by God's grace. Take care and bye for now.